Hi there, I'm Christine, and this is the Canadian Constitution Foundation's Freedom Update. And today I want to talk to you about healthcare choice in Canada and the rights of patients to make their own decisions about how to access healthcare. And I want to tell you about a really exciting and novel case that we at the Canadian Constitution Foundation are involved in. If you're new here, welcome. My name is Christine, and I'm the litigation director for the Canadian Constitution Foundation, a Canadian legal charity that fights for fundamental freedoms in Canada. I upload regular videos about our ongoing cases and other interesting constitutional developments, so if that sounds something that would be interesting to you, please hit like and subscribe below. It really helps my videos out a lot. Also, please remember that these videos are for your information purposes only. They are not legal advice. If you have your own legal question or problem, please consult your own lawyer. So I want to talk about healthcare choice in Canada. And what a lot of people might not realize is that right now it is effectively illegal for most Canadians to purchase healthcare insurance or services for themselves or their families when the public system makes them wait too long for a publicly covered procedure. The ability of patients to choose how to access and pay for their own healthcare is something that people around the world do have, and Canada is the only developed country in the world with this legal prohibition. And patients do wait too long. According to government data that was assembled in a report by the charity Second Street, 11,581 patients died while waiting for procedures between 2020 and 2021. Our healthcare wait times in Canada are really just appalling. A 2020 report by the Fraser Institute found that Canadians were on waiting lists for more than 1.2 million procedures in 2019, and that wait times had increased by 143% since 1993. The OECD recently placed Canada 31st in hospital beds per population among developed nations. A McMaster study that predicted that COVID might cause surgical wait lists to increase up to 7 times was updated in May 2021 with a warning that said, as it may turn out, our worst case scenario is turning out to be a gross underestimate. And long wait lists have real consequences for patients. Long wait times can cause conditions to deteriorate and even become inoperable. Patients who can't get timely care not only suffer because of the pain during the time they spend waiting, but they also have worse medical outcomes and can even die while waiting for a medical procedure. I think that this is just terrible. If I or one of my parents or one of my children was in pain or had a condition that was deteriorating as I waited, I would do absolutely everything in my power to get them care as fast as possible. But the law in Canada prevents patients from getting this care in a crucial way by paying for it, either directly or indirectly through private insurance. This is wrong, and it's why we at the Canadian Constitution Foundation are fighting for patient rights, the right to choose to pay for your own healthcare if the government system makes you wait too long and fails you. We're involved in a legal challenge in British Columbia brought by a surgical center called the Canby Clinic and also brought by a number of individual patient plaintiffs. Now, private non-government clinics have existed in British Columbia for more than 20 years. The Canby Clinic opened in 1996 and has helped thousands of patients. But in BC, the government has a law that is attempting to shut the Canby Clinic and other clinics like it down, which would stop thousands of patients from getting access to healthcare. The law is called the BC Medicare Protection Act, and there are 2 parts of the law that the government's relying on to shut down these surgical clinics. The first part of the law prevents surgeons from working in both the public and private healthcare systems, and the second part of the law forbids private insurance from covering government-insured medically necessary procedures. Together, these prohibitions effectively stop access to private treatment in British Columbia for most residents, including those who are suffering on long waiting lists for referrals and treatment. In Canada, federally, we also have something called the Canada Health Act. This law establishes the framework for federal financial contributions to the provincial and territorial health insurance programs, commonly called Medicare. Now, to receive federal funding, the provinces and territories must comply with the terms of the Canada Health Act, which establishes the principle of universal single-payer healthcare. The basic requirement of the Canada Health Act is universality. To qualify for federal funding, provinces and territories must provide universal coverage of all insured health services for all insured persons. Now, neither of the two BC restrictions in that law that I mentioned are directly required by the Canada Health Act, and the Supreme Court has affirmed that the federal law does not prohibit private healthcare, nor is either of those two restrictions obviously necessary to protect the public against user fees or other barriers to access in the public healthcare system. Instead, it just appears that BC's government is terrified of any perceived threat to Medicare and deeply suspicious of private healthcare, and basically they want to crush it. BC's Medicare Protection Act goes beyond the goal of universal care, a goal that I think most Canadians think is a good one. With the blanket prohibition in BC against private pay insurance and dual practice, the law effectively prevents patients who have not been adequately treated by the public system from obtaining treatment that they need outside of the system. The government's litigation position is that it's better for all Canadians to suffer equally than to allow individuals to use their own financial resources to exercise choice about their own healthcare. Now, there are many examples of the terrible consequences of long healthcare wait times. I'll tell you just a few of them, but I'm sure that every Canadian watching this video knows someone who has been impacted by extraordinarily long government wait times. Now, these are some of the stories of the individual patients who are involved in the litigation in British Columbia that I'm talking about. The first is a teen girl named Christiana. She was an elite athlete and had expectations of achieving a soccer scholarship to university. But in April 2011, shortly after her 16th birthday, she injured her knee in a soccer game. She had a complete ACL tear, and while waiting for her consultation, developed another tear. According to the consultations she received, this needed an emergency surgery because of the severity of that tear. Now, because she was a pediatric patient, her maximum acceptable wait time for surgery was 16 weeks, and this would be October. Her injury, as I said, happened in April. But she was told that because of wait times, she would not be able to get her surgery until April of next year, a year after the injury. At that point, she'd be 17, and she may not get permission for the faster track pediatric surgeries. Pediatric procedures are supposed to have shorter wait times because of the speed at which children grow. They need to have shorter wait times. Christiana continued to wait in the public system until January of 2012, when she and her family learned about the Canby Clinic. And in January, she saw Dr. Brian Day at the Canby Clinic for a consultation, and a few days later, he performed the surgery. Now, that second tear that she received is a really, really serious injury, and it is a very especially long-term concern for a pediatric patient. And that second tear occurred as a result of her long wait time for her surgery. Now, her recovery after Dr. Day at the Canby Clinic performed her surgery, her recovery was successful, and it allowed her to get back to playing soccer, but it did not allow her to return at the elite level or to return to her elite team. And as a result, she was unable to obtain that soccer scholarship. Now, that's just one story. There's also a patient involved in the case. His name is Walid, and he was diagnosed at age 8 with a spinal problem that causes a severe forward rounding of the back. And in his case, the rounding was very extreme at 50 degrees. It's also a progressive condition, so the longer surgery is delayed, the more severe the curvature becomes. And the more severe the curvature becomes, the more dangerous it becomes to perform the surgery. The curve in Walid's spine continued to progress as he waited for surgery and ultimately progressed to 100 degrees. Walid and his family waited 13 months for consultation, and when they finally got that consultation, they were told surgery was very high risk, but without it, his prognosis was extremely poor, but that the wait for surgery could be 2 years. And before that could happen, Walid needed a second consultation. And while he continued to wait for that second consultation, his condition continued to deteriorate. Ultimately, he deteriorated so much that his condition was no longer deemed urgent, and he and his family were told that his condition was so dangerous that he could expect a spontaneous spinal cord injury, a punctured lung, or irreparable organ damage. They were also told that the correction that they could achieve was now more limited because the longer his spine was left untreated, the less of a correction he could achieve. After waiting so long, Walid's family ultimately began looking for other options, and like many other Canadians, turned to the United States. In July of 2011, Shriners Hospital in the United States contacted Walid's family after seeing a news story about him. Walid had an MRI done at Shriners in October, and his first procedure was performed in November. He had his spinal surgery in January, at which point his spine was now curved at 127 degrees. And by this time, they'd been waiting over 2 years for their referral in the BC government system. Now, Shriners was able to perform this surgery, but due to the lengthy wait time and complications in the surgery, Walid was left paralyzed below the navel. Walid's family complained to the Patient Care Review Board in British Columbia while they were waiting for surgery, and in April, after he'd had surgery at Shriners, the board completed their review and found that his delay was unreasonable and allowed his condition to deteriorate and increased risk to his health. The board found that his case was an indication of system failure. Now, Walid is one of the patients for whom the worst has happened, but similar risks are faced by BC patients every day as a result of waiting too long for medically necessary diagnoses and treatment. Another story is that of Mandy, who's also involved in this case. She was diagnosed with stage 4 colon cancer at age 35 after waiting too long in the public system for a colonoscopy. She obtained a colonoscopy privately at the Canby Clinic, which enabled her to have a more timely cancer surgery. Her experience began in May of 2011 after she noticed some bleeding, and she attended her family doctor and was referred for a colonoscopy. But her first appointment for a consultation was not until November, 7 months later. She then had a second bleeding incident and became very worried. Her doctors thought that it was unlikely that she had cancer, but she felt that there was something wrong. So she decided to get a consultation and colonoscopy at the Canby Clinic. After they performed this colonoscopy, the clinic found stage 4 cancer, and she was admitted for emergency surgery in June. She started chemotherapy in September and then needed another surgery in October. The treatment and the surgeries were mercifully all successful. All of this happened. Her colonoscopy, her diagnosis, her treatment, and her recovery, that all happened before November, which was when she was scheduled to have her colonoscopy in the government public system. Imagine what could have happened if she had waited. It's very likely that Mandy's ability to access care at the Canby Clinic saved her life. This is because by the time her cancer was found, it had already spread to her liver. Many Canadians have a similar experience, either a long wait list for themselves or for a loved one. Many Canadians are very proud of our universal healthcare system, and the universal system, a system that allows anybody to access care, that is a laudable goal, and that's something that I embrace and that we embrace. But access to a waiting list is not the same thing as access to healthcare. The government's symbolic assertion that a prohibition on private care is necessary in order to secure equity, that's used as a cover for the extensive and real harm that occurs when individuals are left to wait indefinitely, often at peril of serious health deterioration. Asking patients to endure pain, loss of mobility, and even death in order to symbolically protect a social program is an unacceptable instrumentalization of patients to the prerogatives of the state, where the state isn't even showing a convincing case that this sacrifice is necessary to protect this social program in questioning. This, in my view, is a really cruel kind of tyranny. Now, it might surprise some of you to learn that this issue is even being litigated in 2021 because there's a well-known Supreme Court case in Canada from 2005 called Chiuli and Quebec, and that case dealt with a very similar issue. In that case, the Supreme Court concluded that similar Quebec prohibitions on private pay insurance violated the Canadian Charter of Rights and Freedoms guarantee against government deprivations to life, liberty, and security of person. In that case, the then Chief Justice Beverly McLaughlin observed, to quote, "Access to a waiting list is not access to healthcare." And since that time, Quebecers and visiting patients have enjoyed access to a growing number of modestly enhanced ranges of private facilities, although the Quebec government has acted somewhat timidly in response to the decision, and it really has had very little impact on waiting lists at this point. But the reason it's being litigated is because the Chiuli decision doesn't apply outside of Quebec, and that's why we're involved in this case in British Columbia, which would much likely, in all likelihood, have a wider impact. So the question in this case, which we're involved in, but is brought by the Cambie Clinic and by 4 patient plaintiffs, is a really simple one. Can the government prevent patients from paying for their own healthcare at independent, non-government clinics if government hospitals are failing to perform medically necessary surgeries within the maximum acceptable wait times? Or is this prohibition a violation of the Section 7 Charter guarantee to security of person? Now, nothing in Canada's Constitution requires the government to provide medical care, let alone create a government monopoly on healthcare or provide healthcare on specific timelines. This case isn't about whether Canada must have a universal healthcare system. Every party involved in the litigation, including us at the Canadian Constitution Foundation, agrees that the public healthcare system is important and should be preserved and even improved. Rather, the patients and medical clinics involved in this case have argued that the government system is failing patients by leaving them to languish on long wait lists at great cost to their health. It's an infringement on patients' charter-guaranteed right to life and security of person to restrict them from going outside of the government system to meet their healthcare needs when the government system is failing. Health outcomes worsen the longer it takes to treat them. Think, for example, of the story of Walid, the pediatric patient who waited more than 4 times the maximum acceptable wait time for surgery to repair his spinal curvature, and how that curvature progressed as he waited, which led to a riskier surgery and ultimately left him paralyzed and in a wheelchair for life. So where is this litigation now? The court challenge has taken a really long time. The court challenge began in 2009, and the trial took more than 4 years. The government regularly attended court with 10 lawyers present, while the plaintiff, Dr. Brian Day, founder of the Cambie Clinic, who was fighting to preserve his business, his calling, and his livelihood, he was represented by a single lawyer from Vancouver and his junior. The government objected to nearly every attempt to introduce evidence by way of patient, physician, or expert testimony, and after the first 7 months of trial, Dr. Day was forced to ask for an adjournment so that he could raise some money in order to pay his legal bills. The trial decision was finally released in September of 2020, and the trial judge agreed that the serious wait times and the ban on alternative care did amount to a violation of the charter protected right to security of person, but the judge found that the denial of this right was consistent with the principles of fundamental justice. Now, on its face, this is a really bitter pill for patients to swallow, especially patients like Walid, who's now paralyzed after his unacceptably long surgical wait time. Now, in our view, and in my view, it's fundamentally unjust that a child would be confined to a wheelchair for life in the name of an ideology that demands government have monopoly on healthcare, especially when the government has proven to be incapable of providing timely care to thousands of patients. The statistics in the litigation show that in British Columbia, there are over 30,000 patients each year who don't receive surgeries within the government's own maximum acceptable wait times. And we can expect that with COVID, that scenario is actually deteriorated, it's gotten even worse. Those wait times have gotten worse. And the monopoly requirement, the government monopoly on healthcare, is completely unconnected to the goal of preserving the public system. Independent clinics have existed in British Columbia for over 20 years, and there's no evidence of harm to the public system during that time. Canada is actually an anomaly among our allies at the OECD who have both functioning public and independent healthcare systems. And in fact, the Commonwealth Fund report indicates that these other countries do a better job of providing timely healthcare than Canada does. So after losing at the trial level in June of 2021, the case went to the BC Court of Appeal. And the decision in that appeal has not been released, but the clinics in BC have been operating because they obtained an injunction. So those clinics have been permitted to continue operating in British Columbia, continuing to treat patients who the public system is leaving beyond maximum wait times. And in the meantime, BC's Health Minister, Adrian Dix, has proudly touted this strategy of tapping the private clinics to clear the surgical backlog that has resulted from pandemic-caused cancellations. It's a really deeply ironic strategy of rank opportunism, given that these same clinics the government is trying to shut down. So it's been many months. The appeal was heard in June of 2021. I'm filming this now in March of 2022. We do expect that a decision will be released very soon. It's already been many months since the appeal was heard. But, whatever the outcome is, we believe at the CCF that this case is of such national significance that no matter the outcome, it's ultimately going to the Supreme Court. And aside from the legal fight about healthcare choice, there's hope on the horizon for shifts in policy. Polls have been showing that a consistent, if small, majority of Canadians believe that we should have the right to purchase private health care and private health insurance if we can't receive timely care, timely access to treatment in the public system. There's good reason to believe that the level of support will continue to increase and that openness to private options within a universal healthcare system will continue. You can learn more about this case by visiting YourHealthCantWait.ca, and you can also receive regular updates about the case, including an immediate update as soon as a decision is released if you sign up for our Freedom Updates at theccf.ca/Freedom Updates. Okay, I hope you learned something today about healthcare choice in Canada and what we're doing to make that possible. Thanks for watching, and let's keep fighting for freedom in Canada.